Good morning, everyone. Welcome to the September 2nd Public Health Media Briefing. Just a reminder, this will be the only media availability for public health staff today. So if you have questions, get them in now. We're going to start with an update from public health staff. I'll open it up to reporter questions. As always, please raise your hand. I'll call on you. And with that, I'm going to send it over to Dr. K.
Good morning, everyone. Thank you for joining us. So a brief update on the numbers. We are at 137,232 cases of COVID-19 reported to Sacramento County. We're averaging about 500 to 600 additional cases per day. And the case rate last recorded is at 38.4 per 100,000. This week, we did receive a number of cases that were backlogged, mainly from the Kaiser system. So many of you may have noticed that we had quite a jump of about 3,000 this week for one day, but most of those were actually backlogged. So we're still averaging about 500 to 600 per day. With the deaths, we are at 1,934, and we have seen an increase there. We're averaging about 5 new deaths reported per day. I have to note also that with the deaths, we do have to wait for records before we actually report it on our dashboard, as well as report it to the state. So we still have quite a number that are still pending getting all of the required documentation. Our concerns continue to be with the hospitalizations. We're still near capacity. The numbers do fluctuate from day to day, and the hospitals are coordinating to make sure that if one hospital is not able to receive patients, that they're able to send them to another hospital within the region. We have not had to send any patients outside of Sacramento County. The hospital administration is still concerned, though, that we continue to have capacity to see not just the COVID patients, but also other patients that are critically ill, such as those with stroke and heart disease or difficulty breathing, because oftentimes it's very important, every minute counts, to be able to get the appropriate level of care. So we continue to work with them to make sure that we continue to have that capacity. The other area, the hospitalizations, the last report, we're at 435 in the hospital. The peak for the winter season was 512 at the beginning of this year. So we're very close to that peak. And those in the ICU is 105. The other area of concern is with the children. As schools open, we are seeing an increase in cases among children. Most of them are mild and do not require hospitalizations, but still we are seeing an increase. And now children account for about 20% of our total cases being reported. And so we'll continue to work with the schools. We have a school team that is working to make sure that when there is an exposure, that the children and the staff that are exposed are put on quarantine. I will turn it over to Jamie White.
Hi, good morning. We got a question last week regarding who is being impacted by this current surge compared to prior surges. And I just wanted to follow up with some additional data regarding that. So one of our epidemiologists ran some demographic information on our deaths for the past 30 days compared to deaths overall. And notably, the median age for our deaths in the last 30 days has been age 64 compared to age 76 overall. And also total deaths throughout the pandemic, about 75% have been over 65 or older, but in the last 30 days, more than half have been under age 65. We're still not seeing pediatric deaths, but we are seeing much younger deaths than we have previously. Another notable trend is that Black or African-American individuals are being more impacted by COVID. We're seeing much higher rates of death in that community. Overall, we've had about 11.7% of deaths among Blacks compared to the last 30 days where 24.1% were among Blacks. So about twice what we would expect compared to the population of Sacramento County overall. That's it. And I will pass it over to Liz Gomez.
Thanks, Jamie. So Sacramento County's 13 community testing sites are still working to get to a 30-minute or less wait time, but as many others are experiencing staffing challenges, we are too. Depending on the time of day you come, you may experience more than a 30-minute wait time. In addition, there are national supply chain issues that will result in a shortage of rapid antigen tests for an undetermined time frame. It will impact a number of our partners, including COVID testing sites, schools, shelters, etc. At this time, we still have antigen tests available at our sites, but are encouraging community to consider the PCR test, which is the gold standard, in lieu of the antigen, so we can lengthen the supply we do have for as long as possible. Thank you.
That concludes the update from staff. I'll open it up now to questions from the media. Mike, go ahead.
Hi, this is Mike at the B. Last week, Dr. K mentioned that cases appeared to possibly be on a plateau, but that there were some data reporting issues, which I presume were mainly or all the Kaiser backlog that you mentioned a few minutes ago. With that backlog being entered, do we have any clear idea of what the trend is, which direction we're trending?
When you look at the weekly counts, it actually does still appear that we are in a plateau. And also when you look at the state levels, it does look like the entire state is at a plateau right now.
Any other questions from the media?
I do have another one if no one else is.
Go for it.
I know last week it was a little too early. It's probably still a little too early, but have we seen any impact on vaccination rates from the full FDA approval last Monday?
I will let Rachel talk a little bit about it. And I don't know if we have anyone else from the vaccination team that can address that.
Sure. I'm just looking at the dashboard. I mean, we've had a slow and steady increase. I think I'd like to think some of it's from FDA approval. We're not asking people if that's, why they're getting vaccinated. So it's hard to definitely pinpoint that, but there's been a slow and steady increase, extending into August, and hopefully we'll see that continue.
Daniel, go ahead. You're muted, Daniel.
I'm sorry. So hi, with the Kaiser backlog, how exactly would you say it affected things? And are you confident that that issue won't happen again? And kind of how come it wasn't detected for so long?
You're muted, Doctor.
Sorry. I'm not sure of the reasons for the backlog. I think that's a question that would probably best be answered by Kaiser. But as far as impacting our operations, we do focus on certain facilities. For example, if we have exposures in schools or congregate settings such as jail or the homeless, or if it's at the long-term care facilities. And of course, as you know, with COVID-19, the first week is the most important. So those are the ones that we focus on. And so when you look at the numbers that came in, we've focused on the 400 that were reported for that day.
All right, and then just to follow up on the kids one, 20% seems like a lot. Is that more than you expected, or is that in line? And do you think everything's working correctly? Now we have Sacramento kids starting school this week, how safe should parents feel?
Well, with school starting full-time and also with no social distancing, we did anticipate, especially because most of the children are not even eligible for vaccination yet, that we would see a little bit of an increase in cases. Fortunately, most of them are mild, but of course, we continue to be concerned about some children that might end up with severe disease. And so that's the reason why we ask that all the schools implement the masking mandate, especially indoors. And they have been doing that. Again, with the school team, we have members that will work with the schools, especially as cases are identified, and make sure that children are put on quarantine, and also making sure that they have the testing resources that they need. Nick, do you want to add anything to that?
Yeah, I'll just add that generally speaking, we have seen cases of COVID-19 in the school community, which is to be expected given the high rate of community transmission we have currently. And what we really try to look closely at is whether we're seeing spread of COVID within the school community on campus. And that essentially is a good measure of whether the mitigation measures that are in place in schools are working effectively. Thus far, for the most part, many of the cases that are being seen in schools are examples of children who are acquiring COVID-19 either at home or somewhere outside of the school setting. It's then being detected, they're being quarantined appropriately, and we're not seeing that spread to other people on campus, which is a good sign. That's not universally the case, but for the most part thus far, that's what we are seeing. And so hopefully it stays that way. I think in terms of parents who are concerned, it certainly is a good idea to understand what your school is doing to abide by the guidance for schools and keep students and staff safe. And parents who have questions or concerns about a school effectively doing this should certainly communicate with the school's administration to make sure that they're doing everything they can to effectively implement these measures.
Okay, I'm going to do a last call for questions from from the media. Anyone else?
I got one more if no one else is.
Go for it.
All right. So yeah, the other big thing you mentioned was the high rate of deaths among Black people in the county. What efforts are being done to? I would assume that is related to vaccination rates, or what is behind that? Do you think? And what do you think can kind of lessen that number?
I'll start and then I'll turn it over to Mike. So there are probably multiple factors that are coming into play, but I think a major one is the vaccinations. We know that with the African-American community, we're still lagging behind with vaccination rates. They're still in the 40s. So we've continued to focus on working with that community. We have many partners with community-based agencies. We've had clinics at churches, and also there are other partnerships that are coming up. So I'll turn that over to Mike to talk about.
Yeah, as Dr. Kasiri mentioned, in the past we partnered with a lot of our community leaders, specifically with our African-American and Black community leaders, and partnerships with faith-based organizations, hosting vaccination clinics there, partnering events such as Juneteenth, and we continue to look forward to partner. So we know that the NAACP is having an event this Saturday at the R&B Festival where we're providing vaccination, and then in addition to that, other community-based organization, Del Paso Heights, next week, specifically working with African-American community members providing vaccines. With that said, we're also, in the past, we had a building vaccine influencer, building vaccine confidence with Black African-American community members. And with that, I'm going to share with our PIO. It's on our link that you all could look at. And in addition to that, we also are partnering with media at different ethnic media and media firms to really build vaccine confidence, providing cultural appropriate messaging. And in addition, lastly, at our community testing sites, those are some resources that we work with our Black African American leaders to provide additional resources around testing and providing information around vaccines. So we continue to look forward to build these partnerships and build vaccine confidence within our communities, especially Black communities.
Okay, one more last call. Reminder, this is the only media availability for public health staff today. So if you have a question, now is your chance to ask it. Okay, with that, I will conclude the media briefing for today. I'll be sending out the link this afternoon and we'll post it on our website. Thank you all for joining us.